السلام عليكم أعزائي الطلاب المرحلة الثالثة. إن شاء الله راح أشرح مختبر ال Testing of Sex Hormones. In general خليني أبدي ويا brief talking about the sort of hormones. طبعا الهرمونات موجودة تقريبا بأربع أنواع بالcirculations blood or fluid. ممكن نشوف الهرمونز بشكل free hormones، ممكن نشوفها بشكل protein bound hormone، ممكن نشوفها بشكل red blood cell associated hormone، وممكن نشوفها بشكل conjugated hormones. على مود نقيس كل واحد من هذول الهرمونات أو الأشكال الهرمونية لازم نختار طريقة قياس مناسبة إلها. لذلك test sample of hormones could be vary، يعني أنواع السامبلات اللي ممكن تستخدم لقياس الهرمونات راح تكون مختلفة. طبعا there is about four main type of sample hormones ممكن تستخدم، اللي هي السيرم والسلايفا واليورين والهير. In general السيرم samples if it is used for hormone test طبعا راح يكون له some advantage، وهو يعتبر ال well suited testing for reproductive hormones. مميزاته طبعا يستخدم بال identify endogenous hormone ال accessing or deficiencies. الادفانتج مالته اللي خلته well suited testing for reproductive hormones انه هو simple collections and well established reference range، محدد المدى وبسهولة ممكن انه ينجمع من خلال يعني vein from arm. ناخذ عينة ونقيس بها الهرمونز. يميز هذا النوع من السامبل اللي هو serum sample انه هو يستخدم لقياس ال free or non-bound form of hormones. النوع الثاني من السامبلينج هو السلايفا اللي تعتبر excellent media for measurement of hormones. ونخلي ببالنا انه السلايفا تستخدم for evaluations the free form of hormones. أيضا تعتبر مصدر أساسي لقياس الكورتيزول، يعني مستويات أو نسبة الكورتيزول بالسامبلز. أو ممكن نستخدم اليورين. طبعا اليورين collections is a preferred method for testing hormone, especially for hormone that secreted during night and sleeping, deep sleeping, such as the growth hormones, evaluated steroid hormone metabolites. طبعا ال collections يصير through 24 hours وتقاس عدة يعني هرمونات could be measured totally in this type of samples. النوع الأخير من السامبلينج ممكن يكون hair، قد يستخدم لقياس الهرمونات أيضا. طبعا الhair used to measure cortisol productions. both urine steroid and saliva hormones testing are considered a good biomarker for acute stress. Saliva hormones ممكن تستخدم as a one sample saliva test for evaluated free form of hormones. طبعا تستخدم we are looking at the sex hormones in patients who are postmenopausal, and also studies show that one sample saliva test could be used for evaluating testosterone levels. طبعا السلايفا collections allow a multiple collections over a period of day or month which can help detect abnormal hormone patterns. يعني لأنه السامبل مالتها easy to collect فراح تكون من أفضل الطرق اللي تستخدم for detecting abnormality of hormones through يعني خلال 24 ساعة أو حتى خلال a month. Saliva is best used to evaluate the balance and flow of the estrogen and progesterone in women who are still having MC. لأنه راح تعكس كمية الفري هرمونز اللي موجودة. فالbalance between them could be measured through a saliva test. Also, it can be used to evaluate cortisol secretions pattern by taking multiple samples over a course of day or even a night. And another novel use of saliva, it's for testing hormones in pregnancies. طبعا هذا السلايد يوضح ما قلته بالسلايد السابق إنه saliva test could be used to evaluate the balance of a flow of estrogen and progesterones من خلال making saliva samples test for مثلا for example 2 weeks apart. هذا خلال هالفترة ممكن يبين any fluctuations in hormones or any irregular MC. Also could be used for women who has not have a cycle for 6 to 12 months. So it will give a good sort of levels of estrogens and progesterones to make decisions about what happens through these cases. لو لاحظتوا مصطلح ال one sample saliva test كان بال previous two slides. هنا حنقول cycling hormone panel. ال one sample saliva test معناته ينطيني result of one hormones. بينما لو استخدمت cycling hormone panel راح ينطيني a wide range of calculations for a range of hormones. طبعا هالنوع من ال test or sampling يستخدم for 24 hours to 48 hours for a week for months على مود ينطي مدى التغيرات اللي صارت بالهرمون. This hormone is especially used for someone who has an issue in infertility, ovarian cycle, uterine fibroids, something else related to these cases. Urine test is also a good test for evaluating the metabolites of hormones and also for measuring the unbound type of hormones, especially if it is taken as a 24-hour urines. That sort of samples could be used because it provides valuable information regarding the estrogen metabolisms. As you know, some estrogen metabolites considered as a good estrogens having product against affected on estrogen sensitive tissue, but other metabolites could be considered as a carcinogenic effect. Purpose of the sex hormone test, estrogen could be used for evaluating MC status, could be using for as a aid in the diagnostic of a tumor such as a ovarian tumor, could be used for evaluating infertility and other problems, could be used for monitoring fetal health and development of female characterizations. While progesterone could be used for preparing for endometrium for implantations and also is very essential for maintenance the early pregnancy and for indications the ovulations. And also it could be used for monitoring placental health during high risk of pregnancies. On the other hand, regarding the FSH and LH, LH levels could be using for monitoring the androgens productions, while FSH for spermatogenesis process. Regular measurement for testosterone is very important for male due to their roles in the development of reproductives, also for appearance of secondary sex characterizations, for spermatogenesis, and for bone mass and that sort of things. Testosterone is used for evaluations, male infertility, and if there is any sexual dysfunctions to help determine the cause of hypogynosiums, which is could be result in decreased testosterone secretions. Also, it is important for evaluating the development of male characterizations, and for female, it's very important for evaluate or examine the congenital adrenal hyperplasia, for polycystic ovary, and androgen secretions tumor, also for bone health. Regarding the infertility in male and female, the role of hormones have a good markers for investigation in these sort of cases. For example, for confirming ovulation, progesterone could be used to measure the level in women. Also, FSH and LH. FSH and LH could be used for investigation irregular MC, and for the ovulation disorder, prolactin could be good indicators. On the other hand, for infertility of male, WHO guide recommend analyzing of most common endocrine hormones such as testosterone, LH, and FSH. Regarding the interpretations of the reproductive hormone, keep it in your mind that there is too many factors could be affect the result. These factors could be including age, sex, pubertal state, pregnancy, medications, the free hormones level, timing, and that sort of things. History of measurement of the hormones start since 1960 with the spectrophotometers. Then, after a while, chromatography HPLC was used to determine the level of hormones. Then, at the late of 60, electron capture gas chromatography was used to detect hormone levels. Then, 1970, radioimmunoassay, which is similar to ELISA, was used by using radioactive antigens in the process. And after that, since 1990, ELISA system, enzyme-linked immunosorbent assay system, was used for capturing the hormones based on different based on different procedures like direct assay, indirect assay, and capture assay, and that sort of thing. Then after the latest one is since 1995, which is mass spectrophotometry, which is give a very precise method for measurement of hormone test. This is the end. Thank you very much. If you have any questions, I'll be ready to answer. Please keep in touch with me. Thank you.